Hi, I'm Dr. M. Joe Kaushik, andrologist practicing at Cleveland Hospital, Rigicon. So today we have an interesting friend. He became a friend of us. So he has traveled from so far and come here for the penile implant surgery. So we had done the Rigicon malleable penile implant for him. And the main issue was for him was hard flaccid syndrome. I had showed you on the table that after the spinal anesthesia, how the hard flaccid got released. So we had achieved a good length for him, and we had used a total implant size of 20.5 centimeter, which is 20 centimeter of the implant with 0.5 centimeter of the extender. Bilaterally, we have used the same size, and we are happy to accommodate him, and we are happy to give a good result for him. So let us ask him how he came here, how was his experience here, and how much satisfied with his result he is, and we'll ask him from here.
So, with the highly respected Dr. Kaushik, I had searched through far and wide. I had seen urologists. I will start from the beginning of my journey. I started with the urologist in Singapore, named Dr. Tan. They didn't understand anything about heart flaccid. By the way, there's many Dr. Tans. This won't identify. There's probably billions. But I went to his center. He didn't know what heart flaccid is. He had assumed that somehow my penis had just shrank, and he began to try to sell me a course on using HA. He's like, there's no way we can get your length back. There's no way we can achieve an erection. You can try Cialis, you can try Viagra. And I said, look, none of this is working. And as such, what happened was he became, he slowly started to become less and less helpful. But eventually, I did read through his website, which had the final frontier of treatment. Penile implant. So I'd love to do research. I Googled, is this really the final frontier? Not really. The American Urology Association now recommends it as a first line treatment because it's better to do pills than to do needles and risk losing your size due to fibrous tissue. And I'm sorry, I'm not a medical professional, but that's my understanding. After that, I had gone and met with several of the absolute topmost noted andrologists, and I will not throw any belief upon them. I'm sure they're capable, but there was nobody as warm as Dr. Kaushik. So during this whole time, I joined a malleable support group chat on the website. It's totally random. I just searched implant, and then it said type of implant, inflatable, malleable. I thought inflatable. I don't want too many moving parts. I'm a young man. I just want to have a fun time and enjoy with my partner. And then I came upon malleables, and then I met a person whose name was Manfred. He's from Germany, and everybody knows that Germans are all about efficiency and transparency. And he has suggested Dr. Kaushik, saying that he's a very warm and loving man, and you will get exactly what you need from him. He will not short you a centimeter. In fact, he may give you a centimeter. And when I woke up on the operating table from Dr. Kaushik, I realized that I'd always believed him, but I really believed Manfred at that time, and I have absolute 100% faith in Dr. Kaushik and his nurses too. I speak English. I don't unfortunately speak Tamil. My Hindi is poor. I had a lot of problems. I thought I would have a lot of problems communicating, but whether through sign language or Google Translate, they worked so hard to get the job done. And Sweta ma'am was actually fluent in English as well. So overall, I have, in regards to complaints, my complaint is -1 because I actually have one compliment to give.
Thank you. So thank you. So it was really a happy journey, and we are also really happy to have such a happy person, and he has become a friend to us. Thank you. Thanks a lot.
Thank you so much.